Hi, everybody. Welcome back to the Paradigm Press YouTube channel. This is channel 2. If you're counting the Profits channel, we're very happy to be here today with the head writer of the Catalyst Trader and our chief tech guru, Ray Blanco. Ray, welcome.
Great to be here, Sean. Good talking to you. I know we got a little bit of a time difference.
I know, and I
Uh,
forgot my wine.
yeah, it's evening over there for you. It's morning for me. So anyhow,
Yep.
but good to talk to you anyhow. Maybe I'll get over to that end of things, that part of the world sometime soon.
I hope so. I hope so. And Ray, if I may, before you give us your wisdom, this is going to be, folks, a little bit of a humble brag. The Ray Blanco in front of you right now has been absolutely red hot. We had to get him to you on YouTube to talk about some of the things he has been giving out to our readers lately, and especially his readers. I've been writing about it in the root as much as I can without giving his secrets away. But I will say this first trade of Ray's beautifully rearranged the guts of my retirement account. So thank you very much for that. Let's talk about your first big pick.
That's very gratifying, Sean. So let's start with our most recent sell, which is a biotechnology company, an area I love because no matter what the markets are doing, a catalyst in biotech can really move the stock, as we saw with the company I'm going to talk about first, which has been burst out of the fjords on a longboat, sword and axe in hand, and has turned a really nice profit for us in just 2 months. This is a company I selected in December, and we closed out earlier this. We closed out a couple days ago for a approximately 400% gain. The name of the company is Viking Therapeutics. Um, it is a pre-commercial stage biotech, but it is in a red hot niche in the biotech sector. As you know, you cannot get Ozempic or Zepbound or Mounjaro to, to, to save your life right now. They can't keep up with supplies. There is an obesity drug craze sweeping the country. And the reason there is there's finally something that works really well with these so-called GLP-1 analog drugs. They mimic a peptide hormone produced by your digestive tract that has all kinds of metabolic benefits. I mean, we're not talking just about weight loss and, blood glucose, diabetes control. Studies have shown strong anti-inflammatory benefits, liver protective benefits. A study that was completed last year showed a 25% reduction in major adverse cardiac events, stuff like heart attacks and things like that. So these are just kind of like the wonder drugs of our time, the penicillin of our time, okay? So there's two marketed drugs out there. One is by Novo Nordisk, a European pharmaceutical company that's helped push its market cap to the moon. It's the most richly valued company in Europe, and you're in Europe, so you're over there. Novo Nordisk. And then the second company with a somewhat superior drug is Eli Lilly, an American company. Right now, it's the most richly valued pharmaceutical company in the United States. Goldman Sachs recently published an analysis that if 60 million Americans got on this drug, let's face it, I mean, probably more than 60 million Americans need to be on this drug. I mean, we've got an obesity epidemic in this country. We've got an obesity epidemic in this house. I look at myself in the mirror every day. If 60 million Americans got on these drugs, it would boost GDP by 1% just from improved health, which, healthy people are more productive. They don't take as many sick days off. And generally speaking, I would expect an improvement in healthcare spending, as expensive as these drugs are, because I mean, there's studies out there showing every dollar you spend in a new pharmaceutical product, you save, $8 or $9 elsewhere in the healthcare system. So Viking, it does not have a marketed product, but what's happened with Viking is that they are developing these GLP-1 analogs, second generation or even third generation. And I selected Viking because I've been following them for about 1 or 2 years now in this area. And they had major catalysts in 2024. One being a phase two in the clinical trial process. You got phase one, phase two, phase three, early stage trial, small population, mid phase trial, more people. And then if everything looks good, you go to phase three, which is a bunch of people. That works out. You go to the FDA, hopefully get an approval, and now you're making money instead of just spending it. So they were going to have a phase two readout from their drug, first quarter this year, and also a phase one readout. This is still in the future so this drug is injected. It's like a automated injector pen. You stick it in your belly. It really doesn't hurt, and you dose yourself. But they also got a readout coming up for an oral drug. They got more stuff going on. Let me move through this. The results for their phase two injectable were off the charts awesome. Okay. So almost twice as good as the best product out there, which is Eli Lilly's Mounjaro / Zepbound. All right. Something almost a 15% reduction in body weight at the 13-week mark. To put that in perspective, Mounjaro Zepbound is like 7% or some, I'm not being super exact here, but we're talking about almost double the benefit. If you dig into the data that Viking released, the tolerability is right there, ballpark with everything else that's out there. So it's not something with a worse side effect profile, generally speaking, which means that people are going to love taking it and they're going to lose that weight faster. So, stock went up from here. You got the chart there. Well, you can see it doubled overnight, and we already had a pretty nice run from mid-December from when we entered that. So that's approximately a 400% gain. I still like this company, guys. We're only at phase two for a number of factors. First, we're going to have phase one for the oral version of the drug coming up any day now. If their guidance is accurate, it'll be by the end of the month, first quarter. They're not a one-trick pony either. They've got a very promising drug in non-alcoholic steatohepatitis. What the hell is that, Sean? It's fatty liver. Millions and millions and millions and millions of people in the United States have it. It's a silent killer. You don't know anything's wrong, and then you start having problems. You go to the doctor. No, you've got a fibrotic liver now. It's not just a fatty liver, it's a fibrotic liver. Oh, you've got cirrhosis of the liver. And if that progresses, Sean, it gets to a point where you get liver failure. The only thing that's going to fix it at the current state of the technology is a transplant. So if you can identify these patients and give them a protective drug that prevents progression, it's a real lifesaver. And it's a big moneymaker. A few years ago, Gilead Pharmaceuticals made bank on a hepatitis C drug. Okay. There was, Sovaldi, the $1,000 pill. Okay. It was in the New York Times. But they were able to justify the price because of the benefit for these patients that had this virus, a big problem with the boomer population, by the way, this virus just wrecking their livers. So a lot of money to be made there in liver health. And what we're going to have here in the first half of 2024 is from their trial is going to be data from liver biopsies showing what the state of their liver is. This isn't really, it's not a total dry run. There's a company out there called, I'm drawing a blank here, Madrigal. Okay, they've got a drug of a similar class for the same indication that was just approved by the FDA. Preclinical data suggests that Viking's drug is going to be better. So both of these drugs basically work the same mechanism of action. They target the beta thyroid receptors, which are abundant in the liver. What you want is a highly selective drug that doesn't just target all kinds of thyroid receptors on your cells, because there's alpha thyroid receptors. They're big time in your heart. Don't want to go there. Bad for your heart. You want something that's just going to target the beta subtype in your liver. And that's where you're going to get the therapeutic benefit without that risk to your, to your heart. So the data that we have from Viking is that it is really potent, which means it binds very tightly to the beta receptor, and that it is highly selective, meaning it's very safe. And I'm really excited about this because this, I mean, if you go look at Madrigal's market cap, it's close to $4 billion. And this is basically the majority of the value of this drug. This is a huge multi-billion-dollar market beyond obesity for Viking. Plus, they've got other programs. They've got a rare disease program for a disease called ALD. If some of us watching here might remember a 1992 movie called Lorenzo's Oil, which was about a child with ALD. It's really bad, especially in the brain. Anyhow, great company. I think they're buyout bait. I think their market cap is, I don't know, $7 or $8 billion right now. It's been moving so fast day to day. Yes, 8.3 billion. I think they're buyout bait. You're one of these big pharmas out there that does not have an obesity program. You got a bunch of drugs going into generic status. You're gonna lose billions in revenue. Man, this has got to be a juicy opportunity. You got to think, and you got to think there's people out there talking to them behind the scenes to buy them out. Just an FYI, last year, your average biotech buyout that was a publicly traded company was an 86% premium to their previous closing price. So what you want to look at is high quality biotechs, strong data, moving towards market or recently entered market with a reasonable amount of cash on the balance sheet. Something that a big pharma with their incredible sales teams, can go out, buy, and just, push it to the limit, put the ads on TV, and make, a ton of money on.
I don't understand all the science Ray just talked about either. And that's why I love having Ray around, because he does all the hard work and we just buy the stock and benefit. So don't be intimidated if you don't get all this stuff. I don't get all this stuff either. But yes, let's go on to the next one. That is your Iovance, isn't it? So
Yep. And like I said, I love biotech. And the nice thing is the sector as a whole is coming back.
yeah.
Right now, the XBI ticker symbol is XBI. It's a biotech ETF that I like because it tracks a lot of the smaller names out there, which is where you can make the really big gains. There you go. We're at the highest levels in 2 years right now, after the worst slump post-COVID was, I think, the worst biotech slump since I've been following the sector. Possibly going back even all the way to the 90s. Okay. But yeah, look at that. Going back to early 2022. What you see there was a sort of a COVID bubble in biotech. Everybody got super excited just because, biotech had a big role in what we did to cope with COVID. So I think biotech's looking really hot. We had a breakout earlier this year. But let's talk about Iovance, ticker symbol IOVA. Huge jump there in March. We got a double-digit profit on it last week. Iovance is in cancer, and they do immunotherapy where you're using, instead of taking a chemo drug that makes your hair fall out, well, mine already fell out, and yours did too, Sean. But
For Mother Sand Barber.
yeah, but all kinds of horrible side effects. My mom went through that a few years back. I went through that, gosh, almost 30 years ago. Fortunately, I'm still here, thank God for that, and mom's still here. But what they do is immunotherapy. Instead of taking a horrible chemo drug, You help use the patient's own immune system to heal the disease. This is something they noticed over 100 years ago, back in that primitive days compared to us right now in terms of cancer treatment. Back then, all you had was surgery, for a tumor. They noticed that, this patient has cancer, but they caught the flu, or they had some sort of infectious disease, right? And their immune system, in dealing with the infectious disease, all of a sudden the tumor shrank or it even disappeared. Well, the infection amped up the immune system, and as a side benefit to fighting off the infection of whatever infection it was, it also attacked the cancer aggressively. So that's what this company does. They are going after using your immune system to attack cancer, and they do it with cell-based therapies. They're not using a drug, they're using your own cells. And the way this works is, if you have a tumor, um, they call it a resection. It's basically a biopsy of that cancer that you have, and they'll take out, inside of the tumor, you've got your own immune system cells in there fighting it. So there's a type of white blood cell called a tumor infiltrating leukocyte. So they take these leukocytes, tumor infiltrators, and they grow them in culture. So there might be 10,000 in there that they got. They'll make a billion of them, and then in the lab, and then they'll just put them back in you. And now you've got a billion soldiers, and they just go nuts attacking your tumor. So the beauty of this approach is it's not super tumor specific. Like, they just got approved in melanoma skin cancer for patients that failed a different kind of immunotherapy called a PDL inhibitor, PD1 inhibitor, which is a mechanism cancer uses to shield itself from the immune system, and precision therapy. So these are people that have failed on the best stuff we've got. So they got approved in melanoma because they got really good results in these patients. So what they do is, like I said, they take these tumor infiltrating, these TILs out, they multiply them, put them back in the patient. There's no drug involved, dude. It's just they made your fighter cells, and they made a bunch more than you can make, and put them back in you. Um, so the beauty of this approach is, okay, they got approved in melanoma, but they're going after um um non-small cell lung cancer, cervical cancer, other types of cancer. Okay, because guess what? They can go into your lung cancer and do the exact same thing. All right, so just a revolution in how we deal with cancer. A big gain on approval. The day after FDA approval, they're already doing resections on their very first patient. I think this is going to be a very well received therapy. And buyout bait here for big pharma again, in my estimation. I think we could see them bought out for a huge premium. You wake up in the morning and, hey, man, on top of the gain I made before, I'm up 80% or maybe even more than that, because, Bristol Myers or Merck or one of these guys went ahead and added them to their portfolio.
Wow. That's amazing. So we're not just looking at a target price. We got target price plus acquisition. Love it. Brilliant. So that's Viking and Iovance. The last one, Ray, you wanted to look at had a bit of a big jump and then a little bit of a R2D2 fall over.
Yes, let's talk about that one.
Great.
So that is ticker symbol LUNR.
You got it.
And probably everybody's heard this story at this point. It's Intuitive Machines. LUNR, lunar, kind of cues you in what I'm talking about here. So what happened with lunar is, well, they landed on the moon. NASA is followed up on the success of its resupply program for the International Space Station, which is just to hand out contracts to private industry instead of trying to reinvent the wheel. Very inefficiently, by the way. NASA is not efficient. It's a government bureaucracy. We could talk about for an hour about that subject, Sean. I know you would love to. Um, but you know, they did this contract program with private industry. SpaceX was one of the early beneficiaries, initially launching cargo under contract for NASA to the ISS. And later, once they had proven out their Dragon 9 rocket and had it human rated, bringing astronauts to ISS. So they followed up with that with a moonlander program. In January, we had the first company, Astrobotic, but I mean, as soon as they got delivered into orbit, they had a propellant problem, total 100% failure, and they never even got to the moon. In February, here, what we had was Intuitive Machines' turn, and they launched under that same contract program. A week before the launch, I queued in my hype cycle reader. We kind of tried to do the Gartner hype cycle. This, you know, a new technology emerges. People get very excited. You see rapid gains in that hype cycle, and then you try to sell somewhere early in the hype cycle and somewhere late in the hype cycle to make a quick gain. And we've had a lot of success with that over the years.
Mm.
So last week I said, hey guys, you know, this is gonna get really hypey here over the next week. I'm recommending a buy, and then the following this was I believe it was Tuesday. The following week, Thursday, was the scheduled landing. So the thing launched. You could see we doubled here in a week. Um, you know, and on Wednesday, the day before the lunar landing, I said, look, landing on the moon isn't easy. The Russians have failed, the Israelis have failed, the Indians failed one time, and we haven't actually been on the moon in any way, shape, or form in 50 years since the Apollo program. So I said, it's a lot of risk. It's a double sell. Take some money off the table, sell half, keep, you know, get your original capital back, is what I
Yep.
actually said.
Mhm.
Because if this thing fails in landing on the moon, it's going to come back down to Earth real fast. And well, they did land on the moon, but like R2D2 in the original Star Wars movie, they, you know, they didn't land like this. They landed like this.
Mm.
So it was a partial failure. Now, that said, I still like Lunar. It proved out a lot of its technology, especially its rocket engine and fuel system. Um, you know, they had a failure with the landing sensors. I followed it live when it happened because I really like space stuff. I grew up with Star Trek and Star Wars, you know.
Hey, there you
So
go.
yeah, I'm kind of a nerd. Um, uh, so you know, they got to figure out this problem, but I think it bodes really well for the future. There's hundreds of millions of dollars worth of contracts out there right for the taking. You got the moon program. Supposedly, we're gonna be walking on the moon again in a couple of years. They're talking about putting a base up there. They're talking about in situ resource utilization, ISRU. That means mining on the moon for rocket fuel.
Wow.
They've detected water on the moon. If they can extract water with electricity, solar panels, or a small nuclear reactor, you can take that water, H2O, you got H, hydrogen, you got O, oxygen, boom, rocket fuel. You got both of the of the propellants that you need, and they're very efficient propellants, by the way. And it would be, in a lot of ways, a lot cheaper to make your rocket fuel on the moon than on Earth because, number one, it's almost a perfect vacuum on the moon. There's no atmosphere to have to punch through to get out. Number two, the gravitational pull is 1/6 that on the surface of the Earth. So it takes a lot less fuel. Like if you wanted to refuel a deep space mission and you could make all the fuel you needed on the moon, it would be a lot easier to move it off the moon in terms of the energy required than it would be to move it off Earth. So the future long-term potential here for a company that can build moon landers and, you know, build rockets that can move stuff off the moon afterwards is huge. And we, you know, yes, the thing fell over, but there's a partial de-risk here on their technology. And so, I mean, long term, I really like this as a space economy play.
Yeah, those are, I mean, what an amazing purple patch you've had lately with these stocks. It's just been incredible, and I'm glad to see biotech and space tech, real space tech. I mean, it's just an amazing thing. We didn't, for you youngins who are watching, when Ray and I were growing up, we didn't have space companies trading on the stock market. We had NASA, and that was it. So this is absolutely amazing. Ray, let
Yeah,
me leave the last word with you, mate. What else you got for us?
yeah. Well, if you're excited about biotech or space, check me out. I've got a whole portfolio of both. Recently spoke about the emerging space economy and got a very interesting lower risk way to play that. That said, I expect an IPO boom this year. Starlink, I mean, there were articles in December 2023 about Starlink potentially IPOing. I think everybody knows about Starlink now, high speed space internet. I think if we do get a Starlink IPO, it's going to create a huge amount of hype and excitement in the field in general, which is going to be across a lot of companies. We've got other space IPOs that are being talked about. I've got companies that I think are Starlink killers, by the way, in their own
Yes, you
way.
mentioned that to me because I love Elon. I was thinking about Starlink, and I wound up not getting it because of you. So,
Yeah, well, Starlink killers, guys. I mean, they've got technology that Starlink does not have. Thank God. I mean, Elon's been pretty fair. He wants, he's launching their payloads. He's like almost the only game in town
yeah.
for space launch right now.
Mm.
There's other space launch companies that are they're hitting their stride now. I talk about those companies in my service. And then everybody's talking about chat bots and chat GPT. That was a breakout subject last year.
Sure.
I'm looking a little further down the road and talking about biobots, how AI is going to help you cure your cancer, and give you new drugs developed by AI that the human brain couldn't ever come up with just in 1,000 years. So there's going to be a whole boom there that is going to develop, and I'm getting this positioned ahead of time before it hits.
I think that's a great way to do it. Do it when there's no competition on the bid, as our good friend Rick Rule would say. And that's certainly, folks. It's very important to understand that I feel like Cy Sperling here, the old Hair Club for Men. Not only am I the president, I'm a client, but I am a reader of Ray's research, along with the rest of our fabulous Paradigm team, as well as writing the root for everyone. The picks have been incredible, and I have benefited myself. I cannot recommend you start reading Ray Blanco's Catalyst Trader if you haven't already. It is just chock full of stuff that, again, you don't have to understand everything. Please don't be intimidated. Just the recommendations at the bottom are the really important part for us. But my friend, thank you so much for joining us today. It's been
My
fabulous.
pleasure.
We must do this more often, and we will, I'm sure,
Yes,
over the course of the
I will
next
enjoy
year.
that.
Fantastic. Thank you. And thank everybody. I really appreciate you taking the time. Have a lovely rest of your day.